Hi, this is Jenny from the Facebook group Hope, Love, and Tat, Healing After a Breast Cancer Diagnosis. I'm here with my friend Dae and Dr. Dae Sheridan, and she has a boutique practice in Tampa and specializes in sexuality, relationships, and lots of mental health issues. And can you introduce yourself a little better? I know you have so much going on. I don't want to miss anything.
No, that's okay. So I'm a licensed mental health counselor, a board-certified rehabilitation counselor, and a board-certified clinical sexologist. I'm a professor at USF. I teach human sexuality in the rehab and mental health counseling program, which has a specific focus on, my class specifically has a focus on sexuality and disability.
Okay.
And teaching future clinicians how to manage issues of sexuality in a whole.
So it's been a while since I put this out there on the site. I said we were going to do this interview, but then the holidays kind of came and went. So
Yes.
It's been a little while, but I have all the questions printed out, and I'm very excited to talk to you because this is a huge part of breast cancer that no one really talks about. I did talk a little bit about it in a review I did of a book called Pretty Sick, and she does mention Caitlin Kernan is the author, and she mentions certain products and all of that. She also said that 90% of cancer survivors are having sexual dysfunction during and after treatment. So that's a huge number. The lucky 10% aren't, but I feel like it's higher. I feel like everyone would because your image and everything.
Yes, I would venture to say that that number is even higher. It's just that's what's being reported to physicians. And so many people are not talking about matters of sexual health or sexuality at all. And so I would definitely say that those numbers are much higher.
Well, also, I don't know that my oncologist would have anything to say to me about it. So if I did ask him questions, I think he would just kind of be like, not know the products, not know anything, because they really focus on the chemo and the treatment and the standards of practice. And they don't know nutrition, they don't know about this stuff either.
No, and they're not supposed to necessarily, they're not specialists in that area, but they should know how to refer, and they should have an open, comfortable environment to talk about other things, and their practices should have comfortable environments to talk about other issues that may be going on with you, whether it's mental health related, whether it's something else physiologically related, whether it's sexuality related. Physicians and hospitals in general do a terrible job at this. And so talk about 90%. So the research shows us that 90% of patients across medicine, patients of all sorts, want to talk to their physicians and want to talk to their OBGYNs, want to talk to their oncologists, whoever it is that's serving them. They want to talk to their physicians about sexual matters. However, they want the doctors to bring it up. Well, 90% of doctors will never and won't bring it up ever. And so we're in this chasm of, how do I bring up these issues when, I'm on the clock, I know I have to be in and out of here in 10 minutes, and I know I need to cover these many questions about what's going on with my treatment. And so I may not ask those questions. There's lots of other reasons we may be, there's so much taboo and stigma surrounding human sexuality as a whole. So we don't necessarily have a comfortable, confident working vocabulary about sex and sexual matters. So we may not even know what to ask or how to ask. And so what ends up happening is we suffer in silence. And no one asks us how we're doing. We don't know how to bring it up with our partners. We don't know how to really resign some of the issues that are going on with sexual health, our body image, our sensuality, not just sexuality, but how we're feeling about ourselves and our sensuality, fatigue, all of that. So I think that we need to close the gap between between our doctors and the patients, and ways to be more able to refer out or say, I hear that you have an issue with this, that matters, and so here's what you do next. But so many physicians don't have that training. They don't feel comfortable with their own sexuality. They fear that they won't have the answer to your questions, and then so they avoid it, which then makes us feel like the rest of our culture does, that anything sexuality related is to be avoided. It's shameful, it's embarrassing, there's guilt surrounding it. So it just really highlights some of the garbage that we really have in our culture about sex to begin with. So,
well, and I've talked about this in other areas. If you had a problem before this, it is now magnified. And I think that's the same with sexuality. If you had a problem talking to your spouse, or with any sexual dysfunction whatsoever, the age groups that are on this Facebook group, some already were in menopause before and having these sexual issues, and then they just got worse. And some may have not had the communication or relationship with their partner where they could talk openly about this. And now it's, the magnifying glass has been put on it and made it much bigger. So I'm so glad you're here to help us out with this. Do you want me to read the questions, or should we talk about self-image first?
I think just what you said about how these issues can be magnified and we don't really know how to talk about them. First thing I think that I want everybody to know is you deserve to take steps to give yourself permission to be a sexual being to begin with. Because so often there's so much judgment laden with our decisions about our bodies and about sexuality that we tend not to necessarily know where our values come from about this. It's a lot of trial and error. And so I just want everybody to have the opportunity to think about, well, how did I feel about my body? How do I feel about my body? How do I feel about my sexual self prior to this? So not just how is my relationship with my partner, or how is my sex life with somebody else, but how do you really get along with yourself? What is your relationship with your vulva and your vagina before, and your breasts, and what were, how did you perceive yourself as a woman at that time? So those are the things that I think also get magnified, is our either love or feeling discouraged, or our self-loathing, or the things that, once again, our culture really does a number on us when we are expected to be these sexual objects. Our bodies are only supposed to look a certain way, be a certain shape, certain size, certain color in order to be sexy. So then you add on to already, when there may have not been any sort of illness or, concerns at that time, and we're already struggling with all of these issues. And now to put treatment and surgeries and changes with our bodies, and now that's on top of what we already were thinking about ourselves. And so, I want for us to be able to really explore self-love fully and wholly, because we deserve that. We deserve that affirmation and encouragement about our full whole selves, including our sexual selves. And I think that's been a real gap, especially for women, because our society can be very misogynistic in terms of sexuality, and good girls don't, and down there, we don't even have proper names for our body parts. We're taught to be ashamed of our sexuality. Don't be too sexual, or else you're promiscuous, you're slutty, you're this, you're that. So there's so much that's already laden on here. And so I want everybody to just take a moment to explore and kind of uncover what was going on prior to any treatments or diagnoses.
Yeah, it's a lot. I mean, I didn't ever understand, I've had friends go through breast cancer, and I thought, well, you're done with treatment now. You look great again, you're fine, but your entire body changes. Your skin, your hair, your face, how you feel, your breasts change. Some people get hysterectomies. I did not. Where there were times in treatment where I didn't even recognize myself, and I was certainly not feeling sexy or in any way that self-love or that I was just really fearful of things, and trying to be, everyone on here knows I was trying to be very spiritual and very meditate and find that love and get that connection to myself again. It takes a while. And even afterwards, I mean, I don't look like I did before. So I'm sure it's strange for my husband too. I've known him for 20 years and always looked a certain way. Now I look different. So I know it's not just put on some, get some lubricant and get the right product, and it
But I,
gets done.
but I think that's what we look for, right? That's what we look for, whether it's, somebody who has sexual dysfunction and just goes and pops a Viagra without ever wondering, well, what may be going on in my head and in my heart and in my body that's creating some of these issues. Is it an anxiety reaction, so on and so forth, inability to orgasm? So there's so many things that we do want to just sidestep the deeper thought about it and just get to the next thing. And I think that our society, especially the medical community, really does push what you were saying before you have this personal experience with breast cancer, that you were like, oh, well, you look good, you're fine, so it's fine, so you're fine,
Grow your hair back and you're fine.
Exactly. And that's how the medical community is. It's like, well, thank God we've saved your life. Now I don't need to talk about your dry vagina. That's not something that concerns me. You should be lucky that this is what your outcome was. Now you're on your own, and it shouldn't be this way. There should be wraparound services for people for all different parts. I mean, we now know so much more about nutrition. We know so much more about our need for sleep and meditation and TAT and all of these things that we didn't know before. And part of this holistic care really is about our sexuality and sensuality as well, because if all of these things are going on, mind, body, and spirit, and then we're expected to just hop back in the bedroom and put on an outfit and perform and feel and do and be the same way that we were before, it's actually a ludicrous prospect. That's not going to happen. We're going to be in our own heads, which then is going to lead to a number of difficulties with sexual functioning, because we're helicoptering. How do I look? What do they think about how I look? How do I feel? Is it the same? No, it's different. I don't feel sexy. I do feel sexy, but I don't know if they think I look sexy. So we're doing all of this, and guess who's not having an orgasm? Anybody who's doing that. So we're not able to have the same satisfaction. There's issues with sexual pain, lubrication. There's so much. So I just want for us to be able to uncover and say, you are not alone with this. There's a tremendous population of women who have difficulty having these conversations, who have difficulty with their sexual functioning, with, really aligning themselves with their sexuality and giving themselves permission to be sexual. And again, to show themselves that love, because we're not taught to do that as little girls. We're taught to not get diseases and not get ourselves pregnant and embarrass our families. And that's usually the cusp of it.
Yeah, that's true. So I love that you deserve to take steps and give yourself permission to be a sexual being. I'm going to put that in the comments for sure. And I think that's going to be a tat. Thank you.
Great. And that's great tutelage for our families and for teaching our children, because this is a generational cycle. This is happening because our parents didn't know how to do it either. And then so their embarrassment or their shame or their whatever then gets onto us, and then the media and all of that. Sex is everywhere, being used to sell everything, but we're not supposed to be talking about it, and we're not supposed to be doing it. So a lot of mixed messages about our bodies, especially for women, particularly for women, and how to guide and protect our feminine wilds.
So when you were talking about our bodies, a lot of us no longer have our own breasts. We have implants. This is numb. I have no nipples. It's very numb. And that was a huge part of not only how I look and how I feel about it, because I did really like my breasts before, but they're numb. I'm numb here, and my husband doesn't know what to do with them. And that's and then also, when you're dry, you're numb too. So not only pain, but there's so much numbness. And if you add that to what you were saying before about, your mind is going, there's really no way to jump into the, this.
Right. And I don't think we should be expected to, right? We take rest and we do what's right for our bodies throughout this process. However, we think that we're supposed to perform for somebody else or jump back into being sexual when we might not be ready. And my biggest piece of advice for that is to just take your time. and to go really, really slowly. And it's also about recognizing that our culture, again, there's so much laden with our culture when it comes to sexuality. We're taught that there's one way to do it, right? That sex is one thing. It's, penis and vagina intercourse, and that's it. Well, what happens if there's been prostate cancer and lack of erection? What if there's been, a tumor on the penis and parts have been removed? What if there's, there's parts of your vulva, your cervix, there's parts of your vagina, your breasts that are not there or are not functioning the way that they once did? You have to make accommodations as you would for other parts of your life. And I think that with sex, we try to just stuff ourselves back into that same role and back into the same box. And it's not possible. You've learned to make accommodations for your body and yourself and your energy in other ways. And you've changed so much in your life, yet we're supposed to just get right back, in the saddle. And that's an unrealistic and an unfair expectation that we put on ourselves and that we put on our partners, and that sometimes our partners put on us. So what I would say is, especially working as a rehabilitation counselor, I work with clients who have had significant spinal cord injury, who no longer have any sort of sensation in their genitals, but they don't want to stop having sex. They don't want to stop being sexual. And so what the goal would be is to figure out, well, what are your erogenous zones? Our bodies are not just from here to here and there to there. That's not when it comes to our sexual bodies. We all can experience pleasure and arousal in so many different ways. And there's lots of research that shows that you can move the locus of pleasure to somewhere else and still achieve orgasms when there's no genital stimulation. So I had a client that was able to, he always really loved having his ears kissed and earlobes sucked and all of that. It was very pleasurable for him. He no longer had sensation in his pelvic region. And so he was able to, by stroking his earlobe or, having it kissed or nibbled on, he was able to have an orgasm that way. So it's really important to recognize that how we fetishize and sexualize parts of our bodies, and yes, some of them are really there for a lot of sexual pleasure, have a lot of nerve endings, so it makes a lot of sense. But there are other parts of your body that are just as arousable as your genitals or your breasts. And everybody has different sensations. So it's really about thinking, going way back, what are my erogenous zones? So do I like my, my inner arm tickle? Do I like my neck kiss? Do I like my feet rubbed? What else? Think about other parts of your bodies and how you can build that sensuality and that arousal without even remotely thinking about a part of your body that you've been struggling with, or that has pain, or that there's grief involved. You can move things and practice that. So I also want people to get out of the expectation that sex is only one thing, one way. There's lots of ways to experience intense pleasure sexually, and when it doesn't even have to do with the parts that we normally think of.
Yeah, there are meditations and monks and that have orgasms without even touching any part of their body. So
Absolutely.
I believe you can move it anywhere, including to your mind. So
yes.
That's good information. Thank you. Okay, so do you have any, since a lot of the questions are about products, do you have any products that you would recommend or think that are better than others? In the book, she talked about using vaginal moisturizers on a regular basis rather than lubricants.
Right.
Agree with that?
So you do want to build your own personal reserve if you can, but post-menopause or lots of different medical reasons where you may not be naturally lubricating, you can use vaginal moisturizers to help rebuild that. I do like some of the newfangled fancy laser treatments that are available these days, because what it does is it really helps to rebuild that vaginal mucosa. So you're creating a more youthful ability for the vaginal walls to lubricate themselves, to build that collagen in the walls, to be more flexible, and to help rebuild the muscle. So that's really good too. I did notice in your book review when you're talking about some of the laser treatments and which is normally is called vaginal rejuvenation. So whether you're using it for, post-treatment or post-menopause, or just because you want to tighten things up, it's the same across the board. There's not one that would be different for cancer survivors.
She only talked about FemiLift, and she said it was thousands of dollars. Is there?
It is expensive, and so I'm not recommending that for everybody. But certainly, I wonder if there is a pre-existing condition and there is an inability to lubricate, or if there is vaginismus or dyspareunia, which is the vaginismus is the involuntary locking of the vaginal muscles due to pain or anxiety reactions, or dyspareunia, which is sexual pain, just of having anything to do with the vulva, anything to do with your pelvic floor. I wonder if you can fight and get some of that paid for through insurance. I do believe that because I know some clinicians who are doing that work and are helping their patients fight, because this is, once again, this isn't frivolous. This isn't like, oh, well, I want to just have some fun. No, this is your body. This is your body's functioning and your body's health. And just because we've never put a premium on our sexual health doesn't mean that it doesn't matter. And that is something that, I've certainly written letters for patients to be able to get some of these services reimbursed back to them, because this is about your medical and physical health, your emotional and your mental health. And so I think that is something worth looking into and fighting for. I say any organic water-based lubricant is what I would go for. There's hundreds of them on the market. You can do your own research. People have different allergies. Some people that they're aloe vera based. Some people have allergies. Some people want to talk about olive oil or coconut oil, and the oils I don't think are, and some people may disagree with this, but in 20 years of practice and talking to people about their sexual health, their vaginal health, oils can break down. They can break down and cause fissures and cuts and difficulties with your vagina, and it changes your pH, which could lead to some yeast infections or bacterial vaginosis. So it really depends on what types of, again, organic oils that you're looking to use. I always recommend a water-based lubricant, just so that you can't go wrong with it. There's not going to be, if you're going to have something that's organic and be free of chemicals that are going to do any damage, I don't think that you can go wrong with that. But I would always stick with the water-based. It's more like your body than anything else. And when you're introducing something that's oily and viscous into your vagina, you really are going to change the healthy bacteria that are there that's keeping it safe. The vagina is a self-cleansing mechanism. The only two self-cleansing organs that you have in your body are your eye and your vagina. And so I don't want anybody using any really harsh or particular soaps or lotions or potions. I don't think that that's a good idea.
I know, even just using coconut oil on, as a moisturizer in other places, I know it can dry afterwards. So it might feel nice and oily right then. It like dries your hands out or your feet out afterwards. So that's good advice for sure. Okay, so let me just look through the questions really quick. We've had a few people private message me or post on the site, and all of them are saying thank you for talking about this. So I know we could talk more about this, and again,
absolutely,
after this. Okay,
we could do a little event where we have everybody come in and we can just talk about it for an hour or two.
Yeah, thank you. That was I'm gonna hold you to that. That would be amazing. Okay, so this goes to self-image. I'm used to what I see in the mirror now, whether I like it or not. But having to expose my Franken boobs still makes me uneasy at times. What is your advice?
So the advice would be to really work on your self-talk. I know you know so much about this, Jenny, and you work on this consistently, and with all of the people that you're sharing TAT with. And what we're saying about our bodies, we are going to feel about our bodies. And so our own worst enemy is going to be at play using critical negative self-talk if we're unhappy about something. I want you to think about the way that you would, what advice would you give to your best friend about this? You know, how would you want them to talk to themselves about their body? Because we tend to be very critical and think, well, we don't deserve that kindness, but we would never talk to somebody we loved the way that we talk to ourselves in our own heads about lots of different things. And so with that being said, are you, when you say expose my franken boobs for the first, so is that in with a partner that you've been with? Is this a new partner? Is it a new relationship? Is it considering dating? So I really think it depends on where you're at, what I would recommend, because some of it is, it's all going to be an inside job, right? But there is going to be some of it that if you have a partner, you're going to need to communicate in a really open and expressive way, which creates safety for both of you to be able to explore new things, to be able to explore what you've got in a new way. And, but it really it really starts with watching how I'm talking about myself and about my body. And you can align yourself with that. This isn't, my preference, or I'm not happy about it, but this is me. And I think that making a commitment to love your full whole self, no matter what you've done in the past, no matter what you've said, no matter how you think, no matter what you look like, no matter what, we're all worthy and we're all lovable and valuable. And so taking a step and also looking at, am I looking at myself this way because I'm taught to look at breasts in a certain way, like they have to be a certain way to be sexual, I have to look a certain way, our bodies are gazed upon a certain way. And so think about undoing some of the negative connotations, negative messages about body stuff, and also practicing just really severe, particular, intentional self-love. And then encouraging whoever you're going to share your breasts with, or what your body, your scars, whatever it is that you have to offer, and that you are being vulnerable and opening yourself up to love and to connection, whoever you decide to share that with, to have a conversation about it. I think that another thing that we get stuck with is so many people are doing things and not talking about it. So if we have conversations on the front end, which in lots of other countries, that's how we're taught to do it, to communicate about sex before we have it. If we're doing that on the front end, to just talk openly. This is how I feel about things. This is what makes me feel more comfortable. I feel more comfortable with the drape. I feel more comfortable with the lights on. I feel more comfortable with the lights off. So really talking about what's going to make you feel most sensual in that moment.
Okay. So a follow-up question to that is from someone else who is single, and she is asking when and how to explain her new boobs that may look different, feel different to a potential mate.
I would say that's a 100% personal decision. It also depends on the closeness that you have with that potential mate, the maturity of the relationship, the maturity of each individual. But I mean, I would say I don't think you owe anybody an explanation about what your body is or is not going to look like once the clothes come off. I think if somebody is going to be shocked or dissatisfied or anything like that, and you want to lay some groundwork, then I think that's up to you to do that when intimacy is imminent. But again, I don't feel like you owe anybody an apology. You don't owe anybody an explanation. That this is who you are, and you're beautiful just the way you are. And I think that that's kind of crucial, is that, again, thinking about what we owe our partners, like having to perform, having to look a certain way, having to be sexy, having to, so if there's something that's different, in any way, shape, or form, you decide to share that, if you decide to share that when the time feels like it's becoming more imminent to you.
And I think that goes to self-image and confidence. Are you apologizing on the first date for who you are by explaining it? How is it coming across? Or are you saying, this is me, I don't want to.
Yeah, just want to I mean, if you want to do the whole want to let you know, that's cool. But you don't, it's not that you have a sexually transmitted infection and that you're not disclosing that. You know what I mean? You're not, there's going to be no repercussions to your sexual partner if you don't disclose that on the first date or before you're going to be intimate. So I think that that's an unfair thing, again, that we owe somebody an explanation, or that, you know, somebody may be delighted by what you have to offer. And so I think we also look at it from the negative connotation of what, what's going to be.
I really do feel that's all self-image and confidence, because you wouldn't even worry about it if you had that unconditional acceptance of yourself, which is.
And I don't want to present in a way that makes that seems like that is an easy task, or something that is just expected, like, oh, well, it's 2020, we have to have this radical self-love, and it's the goal. And I think that when we take the stigma away from that being a goal, or feeling like, well, that's selfish, or that's conceited, or that's uncomfortable for me, because we've been taught so often, just be quiet, be polite, don't worry about yourself, do everything for everybody else, that can become very off-putting or scary. So I really want everybody to take the time to try to manage those expectations that they've had of themselves, and that they feel like their partners are supposed to have of them, and how much of that is your real self-talk, and how much of that is garbage that we picked up along the way.
Yeah, and a lot of it's like you said, it's learned. I mean, we all have grandmothers that were like, I don't want to be a bother, while they're doing everything for everyone else.
Yes.
So
Yes.
stop that energy from going any further. Our daughters never, don't have to deal with that. We are allowed to have needs and wants, and including sexual ones, right?
Absolutely. So Jenny, I have to wrap up, but I can come back and we can do one edit, and we can keep on keeping on. But I have my next appointment now. I started late, and I'm so sorry about that. But we can definitely do a part 2 and keep on going, because I think this is a valuable and really important conversation.
Thanks for coming on. I appreciate it.
All right, I'll talk to you soon.
All right, bye-bye.
Bye.